Hello folks, welcome to another episode of NCLEX MCQ discussion. Today we're going to discuss about a commonly used drug in the hospitals with your patients, that is ACE inhibitors. So I'm going to pop up a question on the screen which is related to ACE inhibitors, that's enalapril, and how to approach these kind of MCQs and how to come to a conclusion about the right choice is something that we're going to learn. You need to understand the concept well. Rather, just memorizing the questions and answers will not work in NCLEX RN examination. Focus more on understanding the concepts. So let me pop up the questions right now on your screen. So the question says, a nurse is providing discharge teaching to a client who has been newly prescribed enalapril. Which instruction is most important for the nurse to include? Now here the point to understand is it is asking you which is the most important instruction. So whenever you get such question, along with these options, they may also pop up the options which may be correct, but that may not be the most important. Here what we need to understand is the approach. Now let's look at the options. First option, inform the client that a persistent dry cough may occur. Second option, instruct the client to report swelling of the face, lips or tongue immediately, that is angioedema. Third option, explain that food may taste different while taking this medication. Fourth option, tell the client that periodic laboratory test will be required. So how to understand? Now you may feel like A, B and C, all three can be the right answer, but no, you have to choose only one. So you need to understand which is the most important instruction. Now let's analyze one by one and understand which can be the right answer. So this is the question and these are the options. Let's understand one by one and I'll explain you why that can be excluded, and at the end we will finalize the right answer. Let's look at option A. Option A says, inform the client that a persistent dry cough may occur. Now, when a patient is taking enalapril, it is very common the bradykinin level will increase in the patient, which can cause dry cough. But that is not too dangerous. That is not one of the most important instructions you should put. Now look at option number C. Option C says, explain that food may taste different while taking this medication. So there is one term called as dysgeusia, which is altered taste, which is very common in these kind of patients, those who are taking enalapril. Now, if you look at this, it may cause altered taste. So we need to tell or we need to advise the patient to avoid extra salt or added taste factors in your food, because that can increase the potassium level. So there are many chances if patient is on enalapril and patient continues to increase their salt intake and taste edifiers, this can lead to increased potassium, that is hyperkalemia. So patient needs to be instructed on that, but that is not one of the most important or something which can cause immediate fatal condition for the patient. No, this won't. Now look at option number D. Option D says, tell the client that periodic laboratory tests will be required. Now it is required. You need to keep checking the potassium and creatinine level, because we want the other functions and hypertension functions to be normal. We don't want angiotensin mechanisms or any kind of mechanisms hampered to increase the blood pressure. But still, that is important, but that is not the most important. Which one is fatal? Let's look at point B. What does it say? Instruct the client to report swelling of the face, lips or tongue immediately. This is the most important. The reason being angioedema. Angioedema is nothing but temporary swelling in the skin and tissues, which can lead to fatal condition, or this can even lead to death. So that is one of the most important. Now enalapril, which is an ACE inhibitor, can cause angioedema, which can lead to airway obstruction. Now if there is an airway obstruction, we need to protect that first, because airway is the priority. If there is any condition which can block the airway, that becomes your priority apart from your blood and circulation. Now, NCLEX RN examination is all about the safety. With you, how safe a patient is. Based on that, they decide whether you are a competent nurse or not. So remember this one point, and whenever you are trying to solve a question, you need to remember this one point. NCLEX RN examination is all about the safety of the patient. How safe a patient is with you. If you keep this concept clear in your mind whenever you are attempting a question, patient safety is the priority. If patient is safe, you get that point. I can assure you that. Keep this concept very clear in your mind. If you want to learn more concepts and you want to participate in more such discussion, follow us right now.